This video will guide you through the process of having a cochlear implant in Manchester, including the assessments, the surgery itself, and the follow-up care. You may like to discuss this content with a member of the Cochlear Implant team. If you do, please contact us via email or text and we can set up a video conference with you. The presentation will guide you through the process of having a cochlear implant, starting with a look at how the ear works, how a cochlear implant works, the appointment schedule, and the surgery. The presentation also explains about the rehabilitation program, and we highlight the realistic expectations related to having a cochlear implant. We also include some patient experiences and look in detail at the different cochlear implant systems that we use in clinic. This video explains how the ear works.
Ears are constantly active. They pick up sound waves and change them into information that the brain can interpret, such as music or speech. Sound is a pressure wave that can vibrate either quickly or slowly. Slow vibrations produce deep sounds, while quick vibrations produce high-pitched sounds. Sound enters the ear and is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets the ossicular chain in motion. The ossicular chain consists of the hammer, anvil, and the stirrup. Sound vibrations move along the ossicular chain and into the inner ear. Within the inner ear, the cochlea plays a central role. It is here that the mechanical energy of sound is converted into complex electrical signals, which are then passed on to the brain. In simplified terms, the cochlea is a spiral-shaped tube filled with fluid. Sensory cells, also called hair cells, line the entire length of the cochlea. These hair cells have varying degrees of sensitivity for the detection of different tones or frequencies. This allows the ear to perceive the entire spectrum of sound. The change from mechanical vibration to electrical pulse is a complex process resulting from the movement of hair cells in the cochlea. Along the entire length of the cochlea, the hair cells are arranged like the keys of a piano. Hair cells located at the base or lower region of the cochlea are responsible for high frequency, while hair cells at the apex are responsible for the low frequencies. As the fluid in the cochlea is set in motion, it causes a corresponding movement of the fine structures on the surface of the hair cells to take place. These movements cause tension differences which produce electrical signals that are passed along the hearing nerve to the brain. The auditory cortex of the brain interprets this information as sound, for example as music or speech. The entire chain of events, including the various steps that convert sound waves from the environment into information that the brain can interpret, happens so fast that individuals can hear sound both continuously and instantaneously. Within this complex chain of events, there are a number of factors which can cause an individual to experience hearing loss. A loss of hearing can range from a mild to moderate hearing deficiency to a total hearing loss. In general, there are three main types of hearing loss which differ from one another depending on the part of the ear that is affected, be it the outer, middle, or inner ear.
This next video explains how a cochlear implant works.
The Maestro Cochlear Implant system was developed for individuals with severe to profound sensory neural hearing loss. The Maestro CI system consists of an audio processor, a small device worn behind the ear, and an implant which is surgically placed under the skin. The coil, which is connected to the audio processor, fits exactly over the implant and is held in place by magnetic attraction. Signals are sent from the audio processor to the implant via the coil. During the operation, the surgeon inserts an especially soft and flexible electrode array deep into the cochlea in order to stimulate a maximum number of nerve fibers. By inserting an electrode deep into the cochlea, the entire frequency range of the cochlea can be stimulated. The non-functioning part of the cochlea is bypassed and the sound signal is directly passed onto the hearing nerve. The microphone of the audio processor picks up the sound signals. The audio processor digitally analyzes and codes sound into a special pattern of coded electrical signals. These coded signals are sent to the coil and are transmitted through the skin to the implant. The implant creates electrical pulses from the coded signals. These pulses are relayed to the corresponding electrode contacts along the electrode array, depending upon the frequency of the signal received. The hearing nerve receives these pulses and transfers them to the auditory cortex of the brain, where they are perceived as sound. The audio processor and the implant work like an extremely fast miniature computer. They are constantly processing an immense amount of acoustic data, allowing the sound to be perceived naturally and in real time. In this way, and for the first time, it is possible to use a medical device to replace a human sense.
There are a number of appointments you need to attend to decide if a cochlear implant is suitable. You may already have had your first appointment, which was with an audiologist who asked you some questions about your hearing loss and also asked you about using your hearing aids, whether you had any problems with tinnitus or your balance, and how your general health is, and also about your home, work and social life. In addition, you may have had some hearing tests. These include a test where you listen to some tones through headphones and press a button when you can hear the sounds. We also test to find out how well you can hear speech when you're listening with your hearing aids. Some people may not be able to benefit from using hearing aids, and so we will decide the best way to assess your hearing when we see you in the clinic. Following this initial assessment, your clinician will explain the next steps in the assessment process and what the most appropriate treatment options are in your case. Once we have established that you may benefit from a cochlear implant, it is important that you gain as much information as possible about the cochlear implant so that you can develop realistic expectations about what the benefits and limitations are. There are different implant systems available from the clinic, and further information about these will follow. Everyone who is being considered for a cochlear implant needs to have a CT scan and an MRI scan. The scans take place in the radiology department at the Manchester Royal Infirmary. The scan appointment is usually arranged about 6 weeks after your initial assessment. You may already have had scans done in your local hospital, and if so, we will be able to request these so that the implant surgeons can review them. After you've completed your assessments, the clinical team will discuss your case at our monthly multidisciplinary team meeting. Here, the surgeons, audiologists and therapy staff will decide if an implant will be suitable for you, including the type of implant and which ear to implant. The surgeons will also decide whether you may need any further medical assessments before the operation. After your case has been discussed at the team meeting, you will be invited to a clinic to meet the cochlear implant surgeon, who will talk to you about the results of your scans, the operation, and the risks involved in having a cochlear implant. This is also your opportunity to ask any questions you may have. The surgeon will examine your ears. If you are happy to proceed, you will sign a consent form and you will be put on the waiting list for a cochlear implant. It is recommended that everyone who is having a cochlear implant receives a vaccination to protect against the very small possibility of contracting meningitis as a result of having a cochlear implant. The vaccination can be provided by your GP, or we can provide the vaccination when you come to clinic to meet the implant surgeon. When a date is planned for surgery, you will need to have a pre-operative assessment at the hospital. This will involve having some medical tests to ensure that you are well enough to have a surgical procedure. Cochlear implant surgery is a safe and straightforward procedure. However, there are some risks and complications, but these are rare. They include loss of residual hearing, tinnitus, dizziness, and an altered sense of taste. If you have some natural residual hearing before the implant operation, it is possible that you may lose some or all of this hearing during the surgery. We cannot predict how much, if any, hearing might be preserved. Our recent experience has shown that in about half of the patients who have hearing preservation surgery, we can preserve enough natural hearing so that patients are able to use a combination of the cochlear implant and a hearing aid afterwards. The cochlear implant stimulates the high frequency region of the cochlea, and the hearing aid stimulates the low frequency area. This is what we call electroacoustic stimulation. You may also experience some numbness in your ear. In a very small proportion of cases, the device may move or fail. You can read more about the risks and complications in the booklet enclosed in your information pack. Your surgeon will also be able to answer any questions you may have. You may also experience some numbness in your ear. In a very small proportion of cases, the device may move or fail. You can read more about the risks and complications in the booklet enclosed in your information pack. Your surgeon will also be able to answer any questions you may have. About a week after your cochlear implant operation, the surgeon will want to see you for a checkup to make sure the wound is healing. Before attending this appointment, you will need to have a post-operative X-ray in the radiology department. You will have a number of appointments to set up and fine-tune the cochlear implant. The first appointment is the switch-on, which is around 3 to 4 weeks after your surgery. During this appointment, we will connect the implant to a computer to program. This appointment usually holds a lot of expectation for each patient, but the experience can be different for everyone. Before we switch the cochlear implant on, we need to set it up by playing some beeping sounds. You will be asked to tell us when you hear the beeps and how loud they are. Once these different levels are found, the cochlear implant is switched on. At this moment, you will hear sound around you, which may be very strange and very different to hearing you have had before. You may be able to recognise speech, but most people will still need to lip read when listening to conversation at first. In the early days, it's really important to wear the cochlear implant as much as possible, as this is the best way to get used to it. We know that the more you practice listening with the cochlear implant, the more natural the sound quality will become over time. This can take several weeks or even months. At the end of a switch-on appointment, we will show you how to use the different equipment that comes with your implant. In the weeks following the switch-on, you will have a number of appointments. These include appointments where we fine-tune the sound. This is a step-by-step process as your brain needs to acclimatise each time we make a change. After the initial appointments, your next cochlear implant reviews will be at the 3 months, 9 months and 12 months stage. At these reviews, we will do some listening tests and maintenance checks to check your progress and make sure your equipment is working well. Once you start to use the cochlear implant, we encourage you to contact us for help with spares and repairs. We are able to send equipment through the post, and we are open from 9 AM to 3 PM on Monday to Friday for drop-in repairs. For ongoing cochlear implant reviews, we advise annual checkups, which will be either face-to-face or using an online remote care system, and this will be discussed with you. Every 6 years, you will be eligible for an upgrade of the cochlear implant processor, and you will receive an invite letter with an explanation of the latest technology. There is no way of accurately predicting what benefits you will get from the cochlear implant. The benefits you gain may depend on how long you have been deaf before you had your implant. In general, people who have been deaf for a short while or have been good hearing aid users in the past are likely to gain good benefit. To begin with, words will sound strange and robotic, but over time and with lots of practice, we would expect good improvements and benefits in a range of hearing situations. More challenging situations are likely to be in noisy backgrounds, in group conversations, or on the telephone. If you have had a long period of profound deafness or limited hearing aid use, you may gain limited benefits from an implant. In this case, benefits may include help with lip reading and better recognition of everyday sounds. Initially, you may only hear beeps and buzzes, but over time and with lots of practice, the sounds will become more natural and meaningful, especially in quieter environments. Everyone has a different experience, and it's important for us to monitor your progress carefully over the first few months of implant use to ensure you are getting the best from your cochlear implant. Please see the questionnaire provided to you to write down your expectations of getting a cochlear implant. Take a moment to fill this in. Rehabilitation or listening practice is the key to getting the most from your cochlear implant. It is important to commit to daily listening practice by wearing your speech processor all the time, as this is the best way to get used to it. In addition to the everyday conversations you have with your family and friends, there are a range of resources that may help you with your training, and some of these are included on the slide. The cochlear implant therapists will be able to advise on appropriate training materials as you learn to get used to the implant. As well as routine listening exercises, the therapy team will provide guidance about using assistive listening devices, listening through loop systems, using a telephone if this felt appropriate, and also advice about listening to music. The more you practice with the implant, the quicker and better you will hear. Currently, the team in Manchester use cochlear implants made by two different implant manufacturers, Medel and Cochlear. It is important that you find out about these and let us know if you have a preference for one of them. The clinical team will make the final decision about the type of implant best suited to your situation, but we will always try to take into account any preference you may have. The cochlear implant consists of two parts. The internal part, pictured on the right, is surgically implanted. The external part, on the left, is provided when the cochlear implant is switched on. These two parts communicate with each other via radio frequency through the skin. The internal implant is very reliable and only ever has to be removed if it breaks down or you get an infection around the implant site. This occurs in less than 2% of all cases. The implant consists of a stimulator receiver package implanted beneath the skin behind the ear. Attached to this is an electrode array that is placed inside the cochlea. Internal parts from one manufacturer are not compatible with external parts from another manufacturer. The external part of the implant is called the speech processor. There are two types of speech processor. The first type is a behind the ear style. It's very similar to a hearing aid, but does not require an ear mold going into the ear canal, as the sound is transmitted through the coil that sits magnetically above and behind your ear. The Medel speech processor is called the Sonnet 2, and the Cochlear speech processor is called the N7. These devices both have disposable and rechargeable batteries. This shows the behind the ear style of processor.
The other style of speech processor is an off-the-ear speech processor. This device sits directly on top of the implant site, above and behind the ear. Medell's speech processor is called Rondo 3 and Cochlear's speech processor is called Canzo 2. Both devices use a rechargeable battery and they are designed to be charged during the night. It takes about 3 hours to fully charge. They are not compatible with a loop system, but an adapter can be purchased. A fully charged device should provide up to 24 hours of use. While it's charging, the Rondo 3 cannot be used. An accessory can be purchased privately for the Canzo 2 to charge while also wearing it.
On this slide, you can see an example of the off-the-ear style of processor. All processors come in different colours and you'll be able to choose the colour that matches your style or personality better from the 4 options shown on the screen. Once we have ordered your speech processor, we are not able to replace it with a different colour until you are due for an upgrade in 6 years' time. The speech processors come with a remote control. This is called the Fine Tuner Echo for the Medell device and the Remote Assist for the Cochlear device. The remote control allows you to turn the volume up or down or change between different program settings. They are provided with the Cochlear Implant and replaced free of charge if they break. Both types of cochlear implant systems have a remote microphone. This can be useful to help you hear better in more difficult listening environments. For example, if there is background noise, in the car, where the speaker is at more of a distance or is softly spoken. The operating range of the Medell Audio Link is up to 3 meters and up to 25 meters for the Cochlear Mini Mic 2 Plus. As well as working as a remote microphone, both of the devices allow you to wirelessly connect your processor to other electronic devices. For example, you can connect the device to your TV using an audio cable and then stream this directly to your processor. The Medell Audio Link is not available for the off-the-ear processor. There is an alternative option, so if you would like more information about this, please speak to your audiologist. The speech processors have a waterproof cover which allows you to wear your processor when swimming or in the shower. Both the remote microphone and waterwear are free gifts from the company and are not supported by the NHS. If you have a compatible smartphone, both companies have their own apps available from the App Store or Google Play Store. The apps allow you to control the settings on your processor from your phone, and they are available for the behind-the-ear processors, that is the Medell Sonnet 2 and Cochlear Zen7, and also available for Medell's Rondo 3. The apps allow you to stream music from a compatible mobile phone. Although these features are available, that's not to say that they will allow all cochlear implant users to benefit from having a conversation on the phone. Speaking on the phone can be very challenging, and if you have not been able to have a successful phone conversation for a long time, you are still likely to find this very difficult with a cochlear implant. This technology allows you to link your cochlear implant with your phone, but ultimately it is your hearing with a cochlear implant that will determine if you are able to use the telephone, either through a Bluetooth app or by placing the handset over your ear. Cochlear's Nucleus Smart app is compatible with iPhone 5 and iOS 10 or more recent, or with Android 10 Pie with Bluetooth 5 or more recent. This is only available for the N7 processor and not supported by the Kanso processor. Medell's Audio Key and Audio to Ear apps require iPhone 5 users or more recent, or Android with Bluetooth 4 or more recent. It is available for both Sonnet 2 and Rondo 3 processors. One app acts like a remote control for the speech processor, and the other app can be used to stream any media, including phone calls and music, wirelessly. A quick question. What could you buy for £6,000 today? A small car? That's how much the external processor costs the NHS, so we ask you to take good care of it. Do you have any ideas how many pounds worth equipment was lost by Cochlear Implants users last year in Manchester? The answer is 150,000, or 25 cars. And finally, if you have any further questions about the surgery, what to expect following your cochlear implant, about the rehabilitation programme, or about choosing your device, we are happy to arrange a one-to-one appointment to discuss these with you. Please ask your audiologist and we'll be happy to arrange this.